Hey everybody, this is Dr. Lisa Whitty Bradley, CEO and founder of Chicks with MDs. Thanks so much for tuning in tonight for the Facebook Live. Tonight we were supposed to talk with Dr. Natalie Santiago, who is a board certified pediatrician and founder of The Vegan Pediatrician, but as happens from time to time, she's a physician, she's on call, and she got called away. So we will definitely do that broadcast, which will be regarding coronavirus in the pediatric population. The things that we know right now is that everything is evolving. Right now, 2% of all cases involve the pediatric population, meaning less than 18 years of age. And she will definitely be here next week to discuss those things. But for now, I wanted to talk to you about what I want to do with this platform during this time period. There's a lot of stress, there's a lot of fear, and there are a tremendous number of unknowns. And one of those unknowns is that I'm using a new platform called Be Live to broadcast on Facebook Live. So tonight is just me. Next week, I'll have a guest. But I'm still figuring things out in terms of what to do with this platform. So just bear with me, because as we roll out these Facebook Lives, I'll figure out how to bring you guys on board so that you can comment during the live broadcast. For the time being, please post your questions at the end of the broadcast, and I'll make sure we get answers for you. I wanted to talk specifically tonight what I've been concerned about, just going out into the community during the day, like to walk the dog or take out the trash and things of that nature. My concern has been that there's been a tremendous amount of discarded PPE, meaning protective personal equipment. And we really have to get into a habit of disposing of these face masks, gowns, gloves, and anything else that you're using, goggles, plastic disposable glasses. Those all need to be disposed of either on site, wherever you're getting them from. Like if you're working in the hospital, they should absolutely have biohazard bags and containers to dispose of those things. And you should talk to your hospital about the appropriate way to manage them. But if you're working in grocery stores or the dollar store or whatever facility you're working for or at, please ask them what disposal protocol they have for PPE, because they should have it. I walked the dog a couple of days ago, and there was PPE everywhere, including in front of my home, like a mask, gloves, those things. We have no idea what the transmission rate is for coronavirus. Everything that they're stating is speculation. So we don't know if it's hours, days, weeks. We really have no idea. And actually, there was an article today that children in Italy and here in the US have been documented to have cutaneous, meaning skin manifestations of coronavirus. Sometimes that is the only clinical presentation of coronavirus, that they have these painful lesions on their feet. And that's how they're presenting to dermatologists or their primary care physicians. So we really don't know about the transmissibility of this virus. So please make sure that you're disposing of your PPE appropriately. I have listed some websites, including how to find your local health department, which should be well-versed and up-to-date on whatever the current standard is for a variety of coronavirus questions and concerns. So I've listed that in the title, the link to to find out your local health centers and health department. Also, there is a website that I've listed. I think it's worldometers.info. And this is up to date on how many cases of coronavirus, how many tests have been performed in the United States or in any country that they have listed. As of right now, 1% of the US population has been tested. Let that sink in. What that means is that we have absolutely no idea what's going on in the United States of America in regards to active infections, those who have been exposed and now have antibodies to the virus, and we still don't know if they have antibodies, can they be reinfected? Are they immune from coronavirus, and if so, for how long? We have no idea about that. So it's really very important to maintain social distancing, to stay home unless you're an essential worker, and if you are an essential worker, to make sure that you are properly utilizing PPE. And another thing is that a significant number of grocery store workers have been infected and have died from the coronavirus. So please make sure that if you're going to the grocery store, that you are going and have a list so you can get everything that you need, so you're not going to the grocery store every day, because every time you go into the grocery store, you're at risk, and you're also putting the grocery store staff at risk. And that's for any place that you may need to go, whatever is considered essential services and is open in your community. The other thing I want to state is that please support your local restaurants, mom and pop shops, whatever is open. Please support them. There are a number of places like plant nurseries and things of that nature that are actually delivering. So please support these places, because if we don't support them, they're going to go out of business. So during this time period, if you have the opportunity to do takeout and things of that nature, please do it, because our local entrepreneurs can really use the business. So there is a link up here that states, oh, somebody commented, hey, Doc, oh my goodness, Dr. Bonnie Simpson Mason, you are a blessing. Thanks so much for commenting. And I'm still figuring out how to, I can show you on this stream. Oh, awesome. Okay. I'm learning, y'all. I'm trying to figure it out. So I just wanted to come on real quick. Stay tuned. We're going to have more docs coming on. We're also going to have some other entrepreneurs. I have to reach out to them and just talk to folks about coming on and giving us some ideas on how to relieve stress, how to exercise during this time period, nutrition, other things that we can do to focus our time and our energy to make sure that once all of these restrictions come down, that we can actually learn from this and be a better society. I know right now there's a lot of division, there's a lot of fear, and I have had to unplug from the news. I listen maybe an hour or so a day, but otherwise I've disengaged. There's so much negativity, and we really need to focus on the things that we can do to benefit each other and the community at large. So write down any questions, commentary. I'll make sure I get those things answered for you. Stay tuned for next week when we're going to have Dr. Santiago, hopefully, fingers crossed. And we're also going to do some things. And also, if you have ideas, things that you'd like discussed, write them down. I'm going to try and get some folks who have actually been very active in regards to the coronavirus and things of that nature, things that I think that are important, but definitely stay engaged with your local community. A lot of us are watching the national broadcast. Make sure that you're also watching the local news, or at least review it. Check out what's going on in your local listing, see what your mayor and your governor are talking about, because what they're talking about on the national stage is just kind of like a comprehensive overview. You really need to know what's going on in your local neighborhoods. What are your active cases? How many people have recovered in your neighborhood? How many deaths have there been in your local neighborhood? And I actually have a link. There's a link. I'll put it in the comments after this broadcast that you can go to that just gives by state. And then you can look and see what the infection rate and things of that nature have been in your local community. So stay on top of things, write any commentary or concerns that you have, and I'll see if I can work in a show on whatever those topics are. But we're going to talk about different stuff. It's not just going to be medicine. It's going to be different things that we're doing. Also, in the evening time, I do like a quick meditation and yoga. If you guys are interested, I'll do that live. It's just like 5 minutes. I don't do long yoga sessions. But if you need to decompress and unwind at the end of the day, I'm happy to do that. So I'll see you next week. I may hop on from time to time and talk about stuff, but just stay tuned, stay safe, stay home, protect our essential workers, and dispose of PPE appropriately. Talk to your employer or your hospital or wherever you are that you're getting the PPE. Talk to them about how to appropriately dispose of those things. Talk to you guys soon. Stay safe. And we're going to make it through this. All right. Take care.